As you may know, we celebrated National Learning Disability Nurses Day last week, last Friday. This session is in keeping with that in terms of celebrating the learning disability nurse population. We're going to hear from Jayne about the acute liaison nurses role. It's one of many critical roles in terms of the roles that learning disability nurses fulfill across the UK, but we are focused here on the three counties of Kent, Surrey and Sussex in terms of our community of practice. A little bit about the community of practice. It's been running close to 10 years now, set up by local people who care about people with learning disabilities and making sure they experience good health, good well-being, and good health services. So it's maintained by a very vibrant community of practice, steering group. Our aim is to support networking, sharing best practice, sharing research as well. The community of practice consists of people with learning disabilities, family carers, lecturers, learning disability nurses, researchers, and creative charity leaders. So a wide spectrum of people interested. If you want to learn more, then please get involved. Please get in touch. Some of our links are on the screen now. And do please just join in with our social media and website, where you can get some regular mailings of the activities and the things that we're seeking to promote. We do run online events such as today, and then also we have an annual in-person conference. So the next one is at Canterbury Christ Church University on the 4th of December. There's currently a waiting list, a huge interest for that. So if you want to join the waiting list, please log on to that. There is a QR code there, which will take you through to a blog and access to our mailing system. After Jayne's presentation, you will hear briefly from one of our steering group members, Daisy Hack, who's a Learning Disability Development Lead at Sussex Partnership NHS Foundation Trust. And she's going to talk to us about a new initiative to help address the learning disability nursing workforce challenges in this region.
Okay. So yeah, thanks for having me. It's really great to see so many people. I recognise a few names. Hi Tricia, hope you're well. I don't know whether you can hear me actually. And Daniel, we've never met in person, but Ronnie did a little bit of work on this, so really great to see you. So we've called it a uniform approach. It's virtually complete. We were commissioned about 2.5 years ago to co-produce a competency framework for acute liaison learning disability nurses in England. Vanessa and anyone else, if I'm not making sense at any point, just tell me.
I've got a rough idea what you're trying to get at. More nurses out there, that's what we want.
Yeah, so this is about the ones in the hospital. And I see there's quite a lot of nurses online today, which is great. So yeah, we were commissioned about 2.5 years ago from Health Education England, they're now part of NHS England. Yeah, before I start, yeah, questions at any point, I won't leave them to the end. At any point, you can put your hand up. The next slide, please, Michael. So the thing I didn't put in this was leader stats, because we all know the leader stats, don't we? And they come out every year, and there's mixed opinions across the nation, aren't there, about the leader stats and people's responses to them. But in a nutshell, we know that men die 19 years younger if they've got a learning disability than the general population, and women 23 in the latest 2022 leader stats. But something I thought was really important for this piece of work was in 2023, the Health Services Safety Investigations Body did a report. So they did a report on the back of the death of a premature individual. So, sorry, a person with a learning disability died of premature death. And in this report, they followed that experience through. They reviewed that death, and they wrote a report. So we were commissioned before this report, but this report directly links to our work. So that report found things that we all know on this call, that the health and social care system isn't always designed to effectively care for people with a learning disability. that people with a learning disability admitted to an acute hospital are often cared for by staff without specialist training, skills and experience in working with people with a learning disability.
Oh, he's ridiculous. Oh, hi.
Yeah, okay, no, that's no one for me.
Oh my God.
The important thing that they found in relation to a competency framework for people with for nurses, rather, acute liaison nurses, was that there's no standard model or national guidance for acute learning disability liaison services. There's variation in how these services are funded, their availability, the size of teams and what they're expected to do. And sometimes that's really great, isn't it, variation, because there's a lot of creativity around England. But this piece of work was specifically aimed at standardising some aspects of the role. It also found that staff in acute hospitals may lack confidence and support in assessing people with a learning disability in line with the Mental Capacity Act, which in our work, which is broader than health inequalities, we find all the time. And it also found that current mechanisms for sharing information about a person, such as a care passport or a hospital passport, and alert flags on the electronic patient record can be unreliable. And instead, they found information's often gathered from friends and family. So the health services, HSSIB, was formed in 2017, and they look, they're quite high level. They look at quite strategic, quite big picture solutions to problems. So when they when they reviewed this case and they came up with these recommendations, the Chief Nursing Officer has to respond. So it's quite at a high level. So we were fortunate, I think, that at the time we were doing the competency framework, this came out. So the next slide, please, Michael, if that's okay. So one of their recommendations was that NHS England develops and issues learning disability liaison nursing service, best practice and workforce guidance to all acute hospitals. This is to help local decision making about specialist learning disability provision and enable appropriate support for people with a learning disability and the staff who care for them. So this piece of work, the competency framework, is has a direct link to that recommendation, because what we're keen to do is often people produce a piece of work, don't they, and then it mightn't get utilised fully. Well, we're quite pleased that this is actually part of HSSIB safety recommendations, and then it really has to have those have to have a response from the Chief Nursing Officer. So moving on. Yeah. So the framework itself. The framework, like any competency framework, contains the skills, the things the nurses do, and the knowledge, the things the nurses know, and the behaviour that the nurses need to have. And we've put it's a nursing competency framework, but there are other practitioners who do the acute liaison role. I'm not sure whether anyone here is in your area aware of them, but for example, the Leeds Teaching Hospital, they've got a core team of 9. They make sure that 50% of the team are learning disability nurses, but they've also got a physio in there and other professionals, and they're headed by a speech and language therapist. So producing this competency framework, we know it's for nurses, and that's really important, but we've referred to other practitioners as well, because often they're in that role. As you might expect, it's based around the 4 pillars of nursing, clinical skills, leadership, education, research and governance. It includes outcomes for each section of the competencies, which has been quite tricky to do actually, because sometimes you write in outcomes around health inequalities. So you want people to have a better healthcare experience, etc. But that might not just be determined by the acute liaison nurse. So it's quite difficult to write specific ones, but they're written now. And we've put a range of good practice in throughout. We've tried to pick the best of the good practice. So some good practice that's come in has been things like, you know, there's a box of some photographs kept on each ward. Well, that's not great practice, is it really? It's just a box of photos. So we've got some exceptional practice. And the whole piece of work was produced by people with learning disabilities families, but lots of acute liaison nurses. some acute liaison nurses that have then become consultant nurses and nurse managers, some nurses that are working unis. So what they have pulled together in terms of good practice is some really quite complex good practice. So, for example, around reasonable adjustments, and this is something I think that Tricia talks a lot about. I don't know whether you want to talk about this, Tricia, if you could hear me. And I know that Sue Beacock does, who's worked on it. Some of you might know Sue, is the fact that sometimes a reasonable adjustment can be very simple, and it's thought of as very simple, but sometimes a reasonable adjustment can be very complex and quite clinical. So a reasonable adjustment might mean days of prep, lots of best interest meetings, mental capacity decisions. It might go on over a period of months. I've got a good example to show you in a bit. So we tried to choose really exceptional practice to illustrate the complexity of the skill set, really, the quite high level skill set of the role. It covers adult and paediatrics, so it's all age, and nurses from paediatrics, Joanne Kiernan, and lots of adult nurses were involved. Now the focus is on learning disability. So we recognise that some teams also include autistic people, but we're very clear that it's on learning disability for a couple of reasons. Three. One, because the needs of autistic people who don't have a learning disability are very different. Two, because we were commissioned to write this just about learning disability acutely. And three, and this is a bit of this is too big for the call. We haven't got long enough. There's something that we're conscious of as an organisation, and I know people on the call will be, is that sometimes learning disability can get forgotten and is getting forgotten alongside emerging conversations around autism. So I'll give you a good example of that. So the Transforming Care programme, the programme to get people out of the locked hospitals. That's come to an end now, nationally, and increasingly that towards the end of its life, and now with whatever it will turn into, has really focused on autistic people. And obviously autistic people are really, really important, but often then the voices of people with learning disabilities get left behind. I don't know whether that rings a bell with anyone on the call, or I know, Tricia, you feel strongly, don't you, about it being a learning disability acute liaison service? Tricia, can you hear me? Maybe not. No. Okay, I'm going to carry on. So the competency framework is just for England, but I'll tell you in a short while about the Four Nations papers. That's Scotland, Northern Ireland and Wales, which we're quite excited about. So if you just wouldn't mind going on, Michael. So the competency framework, so there's 4 sections to it. I'm not going to go into a lot of detail for this because we feel like it's occupied our life for the last year, and it's like I could talk for ages, and I'm sure lots of people on the call could, so I'm going to zoom through them, Vanessa. But so clinical skills, so we start with communication, which is basic, because if you can't communicate with anyone, you really can't do a fat lot with them. So we've had input, obviously, from some highly skilled nurses, but we've also had input from a really skilled speech and language therapist who's overseeing some of this section, which is great. Mental capacity, because again, it's a fundamental and it's often misunderstood by some people. Obviously, the health needs of people with a learning disability. Making reasonable adjustments and really drilling down into the legal aspects of that. You know, it's not something that, it's a real skill set or a particular expertise of an acute liaison nurse, isn't it, to make reasonable adjustments. But we've put a lot of the legal framework in this document, because not only will learning disability nurses be reading this, you might get people that pay for the services, commissioners reading it. So people that might know less on certain topics. There's a section on supporting behaviour. So we're very clear in this section that all behaviour is communication. Yeah, we don't refer to it in any terms such as challenging behaviour. So even non-intentional behaviour is a communication of some kind. So that was really important to lots of nurses. because often they're facilitating someone's ease within the patient system, and that means negotiating with other staff when behaviours might be a bit challenging, but it also means understanding how to work with the person, the family, friends, etc., to really create an environment where the person becomes slightly more regulated and their behaviour calms. And then care planning. So that's clinical skills. Then on to the next slide. Leadership. So there's a whole section on compassionate leadership, which, speaking to several people across the country, we chose to put in, and that's about leadership that really values everyone in the team, and that isn't sort of like top down telling people what to do, but that's bottom up, really valuing every voice and ensuring that people are supported in what is a stressful role. Embedding equality and equity into practice, so a whole section around equality. A separate section that's done deliberately around cultural competency, because we know that people with a learning disability die younger than the general population. And we know from very limited research, only a small amount of numbers, that if you come from a minority ethnic community, you are likely to die even younger. So we've asked lots of people a lot of questions around this topic in this piece of work. So we've said, you know, if you get in, say, a young man, that's Harry on the screen. So he's Indian, British. He's got Down syndrome, he's got a learning disability. How do you make things culturally appropriate for him? And I think because the learning disability nursing community, rightly and with a great deal of expertise, has focused on learning disability for years, there's less developed work around culture and how that impacts. So there's a whole section on that. Collaborative and integrated working with professionals, which is the, you know, the lifeblood, isn't it, of the facilitation role. Obviously, patient safety. Co-production with people with a learning disability and families, which is really important. We've been quite clear in this definition that it's not so, it isn't, you know, dragging someone along to a board meeting talking about a patient story. It's including them in some quite significant decisions, either in their own patient experience, like what do you want your care to be like, or in strategic decisions about, if possible, if it's appropriate, development of new services. That's not always appropriate, but. So being an advocate, so as you all know, I know that there's loads of nurses online, so I feel like I'm, I don't know, preaching to my grandmother, but when a nurse works really well, a nurse is an advocate. So we've got many stories of nurses not going way beyond their roles. So, for example, supporting a really great patient experience, helping the person get better through really great outcomes, but actually fighting beyond that so they don't lose their home. Because some people, if they're in a hospital, their provider might say, well, actually, they're too ill for us to have them back. So we've got loads of examples. We haven't put them all in, but of really great nurses in an advocate role actually saying, hang on a minute, and being at times the only voice for that person, and a very powerful voice you wouldn't often want to mess with the nurses I've met. And then creativity and problem solving. So that's the leadership section. Michael, yeah, cheers. Then, yeah, there's research, evidence and development. So in that section, there's data, and that's really important. And we've written a separate data paper, which I'll tell you about in a moment. Quality assurance, evidence-based practice and research. And we know that nurses are very evidence-based, but often they don't have the time or the capacity or the support to carry out research. So that's something that we're really trying to push with some of the recommendations we're doing, because there's been very little big picture research done around the impact of LD acute liaison nursing. And then facilitating and contributing to peer networks. And we know that acute liaison nurses networks are very vibrant around the country, including a paediatric network that's nationwide. And then the final section, education and facilitation of learning. So there's three things in this, sorry. So the one is the promotion of the role of the acute liaison service. So often you'll meet people with a learning disability And they'll either really know that acute liaison service well because they've used the hospital and they've had great support, or they won't know anything about the role. And so oftentimes acute liaison practitioners don't have time to advertise the role, but it's vital. Then education in terms of for the nurse, and then educating the wider workforce. So it's a very big document actually, and at the moment it's just having a couple of nurses look over it and tweak a couple of bits. It's long, but I'm hoping in the way that we design it, once it's all signed off, you'll be able to just pick bits out of it and use them as you want, rather than look through a whole very long document. Okay, the next slide, Michael. Cheers. So there's accompanying guidance that we've got with it. So we've got the competency framework, then we've got a paper, which is called What Good Looks Like. So that is particularly for commissioners, people who pay for an acute liaison service. Trusts, so lots of trusts are really great, but there's a few trusts which still don't have an acute liaison nurse or a team of nurses. But the What Good Looks Like paper is also going to be made into easy read for people with a learning disability and maybe plain English for families. So that looks at, so that's had a few rewrites, but essentially it's acknowledging that services look different around the country. You can have really great single practitioners. I'm picking on you, Tricia, St. Bart's. But you can have a team, for example, like in Leeds, which is huge, or you might have a smaller team. I don't know, that's sort of somewhere between the two. You'll generally have nurses that are either seconded into the hospital from a mental health trust, they're employed by the hospital. Or we came across one example in Hertfordshire that you'll probably know about better than I, maybe, where the nurses are in the local authority, they're in the council. So with all those different models, we're trying to say this is what good looks like. We've spoken to the Care Quality Commission, CQC, and hopefully they're going to use it when they go in and do hospital visits. There's a separate paper called Good Practice in Data-Driven Improvement. So nurses count data, don't they? So if they're taking your blood pressure, for example, they count numbers and write numbers down. But often nurses, like the rest of the population, like me at times, can be a little bit afraid of numbers. And yet what we've found is that where teams of nurses or single nurses use data as in length of admission, if there's any readmission, data about an individual, data about the department, data about the trust, when it's used really well, it can either prove how good the acute liaison team is, because often people will say to the team, well, what are you doing? Yeah, so it can prove it. Or in some instances, like the Leeds one, which I'll tell you about in a minute, data's been used to grow the service. Yeah. So we've got a whole paper on data-driven improvement. And I think data and acute liaison services, I think that's a whole different project, but we've written a paper. It's actually Dave Atkinson, who, any of you know Dave, who's written about, because he's just sort of he's got numbers in his head, Vanessa, and I haven't. So then we've got a paper on a whole team approach. So we've written up, in partnership with Leeds Teaching Hospitals, the Leeds approach. So Leeds, in a nutshell, is led by a speech and language therapist, which is a little bit different. We're not saying because it's big, it's any more effective than a single practitioner or a smaller team by any means, but we're saying this is one example. And the team there have, all right, I'm reading this because I can't remember it. So 9 staff in total, including the lead. So the lead is a band 8A. There's 3 band 7s. These, Vanessa, are the bands in the NHS, like what people get paid, which is quite confusing if you're not the NHS. So 1 band 8A paid a lot, 3 band 7s, 5 band 6s. Then there's also 2 experts by experience who have got a learning disability and are autistic. They're paid at a band 5. And then there's a band 3, which is an administrator. They've also got 8 other experts by experience that they utilise in different roles. And they've got staff champions. They've got over 260 champions. And the interesting thing about Leeds, and we're not saying this is any better than other models by any means whatsoever, But the interesting thing is they've got speech and language therapists heading them. 50% of them have to be nurses, but they've also got a quality improvement clinician, a physiotherapist, and a senior clinical educator. So it's a slightly different approach. We're going to write up, but we haven't received all the information yet. I think it's Lancaster Teaching Hospitals where they haven't got an acute liaison nurse. They've got champions across the hospital. So they've got staff who are champions, but those champions have a direct line to the matron, if I'm getting it right, a direct telephone line to the matron, which is a different way to do it. And that was funded through a pot of money in the NHS that's called non-tariff payments. So a pot of money they took, I don't know anywhere else that's done this, they took and they funded that for reasonable adjustments, and that's the way they funded the champions. So I suppose what we're trying to highlight is there's just different ways of doing it. None are, you know, there are pros and cons with all of it. Then we've also written up a bespoke day plan for Ollie. So this comes from East Suffolk and North Essex NHS Foundation Trust. And this is a plan. So in that hospital, when anyone's admitted, there is a day plan written up around that individual. And we found this quite fascinating because it's timed and there's a recognition of flexibility. So there's the recognition, well, things mightn't go according to plan, so the times might change, but it's timed. So you've got, for example, Ollie arrives at the hospital at 7:45. And then you've got at 8:15 approximately, this is what staff will be doing. So we've written that up as a piece of good practice because it was just these were too big to go in the competency. Then we've got an example in from Northern Ireland, which is a really great example around complex reasonable adjustments and mental capacity, which is still being written. So those are all of our accompanying guidance, and we'll choose which bits are the most appropriate to put in easy read, but we definitely want some in easy read because we want people with learning disabilities going into the hospital with what good likes and thinking to themselves, well, actually, this is what I should expect. These are the standards I should expect. So we might come back to you about that, Vanessa and Michael. That might be, yeah, that might be something we could do. So the what good likes is already done, but we might do a bit of like the easy read with you, or I don't know, maybe getting it out to people. Yeah, it would be really good. Then we're in the process of facilitating, not writing, but facilitating a 4-nation statement. So we're very conscious that this is England and there's some really good practice in England. It's just fantastic. But equally, there's some really good practice in Northern Ireland, well, and Southern, but Northern Ireland, Wales and Scotland. And yet we hadn't been commissioned to do work with them all. But what the chief nursing officers, the chief nurse for all of those countries, they'd all got together and they'd all agreed with the consultant nurse network, with these very senior nurses, that yes, it would be good if you produced a statement across the whole of the UK to say this is how we see acute liaison nursing. So that's what we're bringing together at the moment with some of the consultant nurses like Chris Hutchinson and some others. And that statement will be, look at all the things that we have in common in terms of acute liaison and the differences. And an interesting, have I got enough time, Michael, just to, have I still got a, yeah. An interesting thing from Northern Ireland, I mean, there's great stuff in each country really, but just the one from Northern Ireland is that they've released the other day, I can't remember what it's called, but I can send it you. It's a plan around equity in healthcare. And they've got agreed, because it's not as advanced, there aren't as many acute liaison nurses in Ireland, although their practice is great, the stuff I've seen. But they've agreed that they're going to have one standard job description. And that if any of the future, a little bit like the Royal College of Psychiatry, if any of the future, any trusts across the country then develop acute liaison nurse roles, they've got to either go by that job description or have it signed off by, I don't know whether it's the chief nurse, but someone that's an executive, which I thought was really interesting. So we can learn a lot from the other nations. And then the final thing is we're going to have a set of recommendations for issues that aren't within the scope. So one issue is, so well, there's been loads of issues. A big one is the lack of research. So there's a real lack of research been done around acute liaison, not because people haven't wanted to do it. Sometimes it's time, isn't it, and capacity of the acute liaison nurses. And we definitely know, don't we, that acute liaison nurses, the impact saves lives. Yeah, we definitely know that, but it's proving that. So I think we're arguing for more research. And just one final thing, what we're hoping to put in the competencies, well, we will put it in as long as it's agreed, is the data from national benchmarking data. So every year for the past, including this year, Vanessa, 6 years, the NHS trusts have sent a load of their numbers and their information to NHS England. And all of that information has been collected together, like the number of acute liaison nurses, and I don't know, the number of certain certain health things. And what they can show from that data now is that where you've got an acute liaison nurse in a hospital, there's less premature death. So we're negotiating with NHS England to make sure that some of that data, which they haven't published openly, can be put in the competency framework as proof of the role that acute liaison nurses play. So I think that's is that me done? I think that's my last. Yeah. Don't know whether there's any questions.
Let me stop sharing that, Jane. Julianne has placed the Northern Ireland work on in the chat. Jess has asked a question about easy read. So the competency framework will be delivered in easy read format as well.
No, the whole competency framework won't. No, it's like 110 pages, and it's essentially for nurses. It's not for people with a learning disability. But the thing that will be an easy read will be what good looks like, because that will say, well, you know, the acute liaison nurse service does this, and this is what you can expect. So that will be an easy read. We might even put it in a film, we're not sure yet. But that's what we need to, this wasn't in our scope, but that really needs to go out to people with learning disabilities. So when they walk into a hospital, they can be aware of the standards to expect, I suppose, and they know what to expect. And I suppose some of that will touch on the competencies, but we wouldn't make every competency accessible now. Oh.
Okay. Yep. Daniel's preempted my question. So in the chat, Jane, are you able to advise on the timeline?
Yeah. So it's virtually finished. It's got 2 nurses who you may know looking at it, commenting on it. So we'll then send it into NHS England. Yeah. So if we want to put the national data in for 6 years, that national data isn't complete till April. NHS England, it'll go to their comms, and that can take a long time, a few months. So I would assume we're hoping to launch it in April. And so I would want us to launch the competency, if it's all possible, and the 4 nations statement at the same time. So we've got several months, Daniel, really. I mean, some of that isn't within our gift, really. That's what, yeah. We can release it on our own as our own document, but it's got to be, you know, released as part of the NHS, hasn't it?
Thank you.
Can take a while.
Yes, no, thank you so much. That was really, really interesting. I work within the Public Health Agency in Northern Ireland, and I was just wondering who is who's involved from Northern Ireland in the 4 Nations paper, because I know there's work ongoing at the minute with NIPEC in regards to competencies for liaison nursing in Northern Ireland.
So there's Owen Barr, yeah, from the university. There's Cleona, who's the first acute liaison nurse in Northern Ireland. There's Siobhan, who works with Cleona, and Siobhan is writing up the best practice mental capacity example. Some of their work is quite exemplary. And then there's, I think there's Ema, so there's another acute liaison nurse. But all of the people that sit on the 4 nations take it back to whoever's senior in their nation. I know he's really knowledgeable. He's very rights-based, isn't he, Owen? He's very impressive.
Yes, he's excellent. Excellent. Thank you.
Thank you, Julianne. Helen Nod? Is it Helen Nod? You got your hand up? Oh.
Sorry. Are you able to hear me?
Yes, can hear you now. Sorry.
Yeah, I think my
Question or comment for Jayne?
Yeah. I just wanted to confirm whether autism for the acute liaison nurses, there are some hospitals that have or are only supporting people with a learning disability or facilitating their health, while we also have other hospitals that that complication, that variance for people who are autistic person. Is this taken into consideration in this framework?
So there's some hospitals that have a team which and it says the team is just for learning disability. I don't know whether anyone wants to chip in from one of those teams, but but sometimes those teams, although they haven't got it in their job description, would support autistic individuals. But there's some teams that have merged learning disability and autism. But there's lots of arguments for and there's lots of arguments against that. But they're very different groups. I mean, we work with lots of people who are autistic, but who also have a learning disability. And I hate the word complex, but they're in very complex situations. And we've also worked with and still work with individuals that are autistic that have no learning disability. They are very different, have very different needs, they're just different. Well, obviously we're all different as individuals, but they're very different groups. Has that answered it or not?
I don't know. It doesn't answer because we know that autistic people, this is separate. People who are autistic, they're autistic. Yeah. And we have learning disability and those with who are autistic, learning disability and autism. So those are two different. But we do have, because currently within the role, as you say, it's not specified in the job description. However, we are required as the learning disability liaison nurse. We are required, and ideally, it's a duty of care. If the trust requires you can't, and it's been added into your job description. We have to support them, and the numbers are increasingly becoming so many because of the people are being now going for diagnostic test, and people are coming up and saying we're autistic, we are struggling with this. So that in mind, it's also putting pressure on the learning disability liaison nurses. And I've seen where you've shown the education. We have not actually had that opportunity to do the research and also to get that training that can also help us to support this neurodivergence client groups. So where is this something that was considered in this framework? I'm not sure whether
it was considered, but we've got Trisha's view. Trisha, I'm sort of speaking for Trisha because I don't know whether you can hear me, but I appreciate duty of care, but well, first of all, it was commissioned just for learning disability acute liaison teams, so we were controlled by that. But equally, we are very much the two different groups, and often people with a learning disability get left out, So if you look at what I was saying earlier, and we don't have time really, and I'll start on a rant. If you look at the end of the Transforming Care programme at NHSE, towards the end of that programme, lots of people were coming through as autistic, and there was almost an impression given, well, there aren't many people with a learning, Tricia, there aren't that many people with a learning disability in hospital anymore. People with a learning disability, I'm not doing this justice because it's a totally different presentation, but they always get pushed to the bottom of the pile. That's not to say that the needs of autistic people shouldn't be met, but I think if you link in with Tricia, Tricia is a fierce champion for the integrity of her learning disability acute liaison nurse service. Daniel, you're smiling.
Okay, thank you, Jayne. There's a message in the chat. If you don't mind sort of dealing with that in the chat from Julie. Jayne, thank you. I know you're not terribly well, so thank you for soldiering on. Really very much appreciated. I wanted to move on, whilst we've got everybody, in the room, and hopefully pass you across to Daisy. Daisy Hack. She's going to give us some great updates.
Yeah, thank you, Michael.
You around, Daisy?
Yeah, that's great. And apologies, I was teaching LD awareness this morning, hence why I've joined late. But I'll be keen to look back at the recording to find out more information about what you've been discussing. So yeah, hi everyone. I'm Daisy. I'm Learning Disability Nurse, and I am working as the LD Nurse Development Lead for Sussex Partnership. And I just wanted this opportunity, while we've got a bit of a captive audience, to promote a new project that we launched last week. So it's a new community of practice, and it's focusing specifically on learning disability education and workforce in the South East region. So just to give some context, I'm sure many people in the room will be aware that we are losing our learning disability nurses, as in our numbers of LD nurses are depleting, are becoming less and less each year. And particularly in our Southeast region, we have the challenge of not having many LD programs available at universities. So we don't have any local courses for individuals to access to become a learning disability nurse. And so that is also then going to impact on our future workforce. Particularly at Sussex Partnership, my own experience, looking at some of the data, we have a retiring workforce, and I feel, and with support from other colleagues as well, to set up this community of practice, that we need to start taking some action. So it's been with support from Kent, Surrey and Sussex, COP, and also NHS England. We are going to be running quarterly meetings, and it is open to anybody that's interested in attending, that is either a learning disability nurse or is responsible for learning disability workforce. So we've got people from the trusts within that Southeast region, so professionals, LD nurses, but also NHS England, the ICB representatives, and as I say, anybody that's interested in finding out more. We had our first meeting last week, which was brilliant, and I'm hoping the numbers are going to grow, and we're going to, as I say, be running quarterly. So the next meeting will be in January. We haven't set a date for that yet, but we will be. So if there's anybody here in the room that is interested in finding out more about that, I will pop my email address in the chat now, and please do just get in contact. I can share more details about what the project's all about and what we're hoping to achieve. But yeah, thank you so much, Michael, for allowing me to use this platform to promote it. I'm very excited about it, and it's something I'm really passionate about, because we know, and I'm sure it's been discussed today, you know, how important it is for us to keep our learning disability nurse identity and make sure the people that we support have that specialist nurse support. So yeah, that's all really, but thank you. And as I say, I'll put my contact details in the chat.
Just say that you're here and what
Is that okay, Michael? Or if there's any burning questions on that, I can look in the chat as well.
Yeah, we've got a couple of minutes if anybody wants to make any comments or any questions to Daisy on that.
I know we've got people from all over attending on the call, so it may be that it's not directly relevant, but again, I just wanted to get the word out. And if you are in the Southeast region in particular, please do get in contact if you'd like an invite.
And if you go through the QR code there, you'll get a link to Daisy's blog on it as well, and obviously learn more about the community of practice. So I think, Vanessa, do you want to close things off?
Right. I'd like to thank everyone for attending this special meeting today, because we do need all our learning disability nurses out there. And also I'd like to thank Jayne for her brilliant update of giving us all the information. It is very much appreciated to you, and many thanks for doing this for us.